hospitals are turning into hotbeds of infection. Drug development pipeline is running dry, and malevolent bacteria is hitting back. The miracle drugs of the modern era, antibiotics, may well be heading towards oblivion. Overuse, misuse and abuse is ringing the death knell for antibiotics. Indians are becoming immune, raising the question whether we are seeing the death of antibiotics. This is an India Today exclusive, only on Headlines Today.
So are Indians becoming immune to antibiotics, till now considered miracle drugs that could save lives? Doctors globally are now pointing to a very real threat of a day when very soon going into hospital for a minor surgery might even turn fatal.
Well, bacteria strains are becoming resistant to antibiotics by the day, and doctors and patients are to blame for this. Misuse, overuse and abuse of antibiotics is fast resulting in these very medicines losing their power to cure. Bacteria are now hitting back. This is the biggest health threat staring India in the face. This is the India Today exclusive that you're watching on Headlines Today.
India is engaged in a war that is more deadly than any conventional warfare. This is war against the unseen enemy. Virulent strains of bacteria that multiply every 20 minutes and that have the potential to wipe out life within days or even hours. This is a germ war that humans may already be losing. Invisible armies of malevolent bacteria are outsmarting drugs, driving humans towards life-threatening crises. And this nightmare is more real than you may want to believe. Till now, modern medicine had in its armory the power of the antibiotic. But what if antibiotics don't work anymore? For many, these wonder drugs have already stopped working. And it could just mean that the death knell for the miracle drug of the 20th century has already sounded.
When he was born, he was 2.5 kgs, and when we went to the doctor, he was okay with the weight. Then again, the next visit, when there was vaccination, he said his weight decreased to 2.3 kg, and according to him, it was fine because in early days, the child decreased the weight. So we were also okay with the fact. But day by day, he was getting, his weight was decreasing, his condition was getting bad, he was vomiting every day, almost every day he was vomiting badly. So we went to the doctor again, and he prescribed some antibiotics to gain the weight, but nothing was happening. He didn't try to diagnose what exactly is happening with him. When we got the test done, we got to know that almost his body, the salts and the sugar and everything was almost gone. He was not. The very next day, we admitted him to the hospital. It was 3rd of April he got admitted, and then we got to know that there was blockage in his kidney, and a major blockage in his kidney, and he was not able to pass the urine properly. It was only the water which was getting passed, and all the toxics were getting inside his body.
So the very troubling question is India slowly losing the war against infections? Remember, there's a 9-fold increase in pneumonia from ventilators in just the last 10 years. That's not limited to that. There's also been an increase, a worrying 5-fold rise in bacterial infections in blood, urinary tract, catheters and surgical wounds. What's more is that there's a rising E. coli resistance, and also if one sees, it's very tough now to treat diarrhea, urinary tract infections. That is the reason why such diseases mostly go untreated. Now, in 2012, tuberculosis germs stopped responding to antibiotics. This is a very worrying development, and India simply cannot afford to lose the war against infections.
Coli, which had this gene modification called NDM1, and rather than taking note of it and doing something about restricting antibiotic usage, what we ended up doing is like starting to make protests against naming it New Delhi metal beta-lactam, etc., which I don't think is the right way to look at it, because then what happens is when we deny the facts of such serious resistance, then we don't do anything about it.
Every passing year, the resistance to antibiotics in India is increasing at an alarming pace, and everyone in the cycle is to blame. Doctors, patients and chemists have contributed greatly to this tide of antibiotic resistance in the country. And now the situation is such that India may totally be unprepared to tackle this health menace. In fact, the World Health Organization has been raising alarms against this hidden epidemic since 2010.
Now, the main question is, what does India need? The very first thing, of course, is an antibiotic policy and national registry. The second thing is a crying need of the hour, inclusion of antibiotic resistance in medical courses as well. The third thing that must be done immediately, monitoring and stopping sale of drugs without prescription. And that, as everyone knows, is fairly common in our country. And fourth, ensuring infection control protocols in all hospitals across the country.
With Damayanti Datta of India Today, Bureau Report headlines today.
On the trail of rampaging bacteria and weakening antibiotics, we covered hospitals and patients across cities.
What we found was very stark proof that India is hurtling towards a time when the life-saving antibiotics of today might just become placebos of tomorrow. Doctors and patients came forward, sharing their stories and opinion to make people aware of the very real danger that they face.
Like thousands of Indians do every day, whenever this 34-year-old professional from Bangalore had a minor ailment, he would just pop a pill. Sometimes even two, to get instant relief. No prescription drugs, no medical advice.
There was a lot of self-medication also, especially when I got onto career, job and all that, there was a lot of self-medication. Because whenever I had a small headache, minor headache, I wouldn't wait for it to just go. I used to pop a pill so that I can get back to work. And like I said, sometimes two pills.
But like everyone else popping random antibiotics, this young man too ran the risk of the bacteria inside him becoming immune to the medicine. Soon he had to be admitted to hospital with high fever, and his kidneys and liver failed. Doctors trying to treat him with antibiotics noticed that his body had stopped responding to the medicines.
We should get out of this habit of popping pills of any kind. I mean, it may be allopathic, it may be alternate medicines, because many of these over-the-counter medicines are not as safe as we think it is. And there is nothing like a safe pill.
Nearly 15 dialysis and many complications later, he has recovered and is back leading a normal life. But he has sworn never to take any antibiotics ever again.
A throat pain will not go on forever. It's going to anyway be cured. So it's good if you don't wait, if you wait actually and not try to get rid of it fast and get back to normal life. Because later on you might have to pay for it.
73-year-old Dulal Chandra Sen has been in and out of hospitals for the last 6 years seeking treatment for urinary bladder tumor. He has already been operated twice and has also undergone radiotherapy. But a combination of different antibiotics prescribed by different doctors has made recovery difficult for Sen.
In the different hospitals that we visited during the last 6-7 years, different types of medicines were applied on him, and definitely it had its toll on him also, because the medicines had its good effects and side effects as well. So those side effects are definitely having some ill sides, and it's affecting his normal life.
With many more cases of antibiotics resistance emerging, doctors are now warning against the use of over-the-counter medicines.
All fevers are not bacterial, and all bacteria are not killed by one particular antibiotic. So it's a clinical decision, and I think it's very important to be judicious in using antibiotics. The key in this is not to use it wrongly, not to use it in combinations, not to overuse it or abuse it.
We should judiciously use antibiotics. We should make sure that we are covering the commonly used bugs, but using one antibiotic at a time in most cases, other than the most dangerous or life-threatening of infections. In intensive care, hygiene is important. We need to make sure that hand washing practices, the cross-infection between patients is as less as possible. And then when patients go back into the community, antibiotics again are used judiciously.